we've done some research recently with the general public to get their attitudes to the idea of taking aspirin on a daily basis to help prevent cancer. So it's very early stage work at the moment, just to get a sense of whether the public would be comfortable with taking aspirin and what their overall perceptions were of it. So we talked to about 60 people, and we also talked to some healthcare professionals. And these were people in the age of 50 to 65, so in the age that we would probably be wanting them to be taking aspirin daily. So overall they were very comfortable with the idea of taking a pill to reduce their risk of cancer. When we introduced the idea of that pill being aspirin, it was quite interesting to see their reaction, because what you found was that a number of them were actually really quite surprised. There was a level of incredulity. You know, aspirin's been around for a long time. You know, why are you only finding out now that it prevents cancer? And also, often new news is interesting and good news, but actually for this, new news was a bit scary, because they were saying, well, how do we know that it's really that it really is the case that it reduces the risk of cancer? And of course, we operate in an environment where people are constantly hearing headlines about sensationalist ideas. So the first barrier, as I said, was this sort of incredulity. You know, how can we really believe this? And one of the and we talked about ways to overcome that barrier, and by far the most important way to overcome that barrier was to have a very credible organisation to endorse and to endorse that. So we suggested different organisations, such as the NHS, such as Bayer, such as Cancer Research UK, the Department of Health. And overall, there was a sense that an independent organisation, and Cancer Research UK was very much mentioned as that, was the best placed to endorse aspirin as something to reduce the risk of cancer, mainly because Cancer Research UK is seen as being very authoritative and also seen as being very independent. We don't have a financial incentive in this, and even the NHS at the moment, with a lot of the things going on in the news at the moment, is seen as not necessarily completely unbiased. So that was the first barrier. The second big barrier that people had was around side effects. There was quite a lot of knowledge that aspirin can create side effects in people. So people were very... in every group we spoke to, there was at least one person who had either had side effects themselves or knew someone who had had side effects of aspirin. So it wasn't just a sort of something that can happen to other people. It felt quite present. So that knowledge was quite strong. And therefore people would really want to be very comfortable that those side effects were very small in comparison to the risk of cancer. And of course, at this point, you know, a lot of these conversations were we stressed they were quite theoretical. We weren't at this point recommending people to take aspirin. It was much more, if the research comes out that says we should, what would be the issues? So knowledge about side effects was critical. And also, they were very keen when they said, "Well, you know, so would you go out if this research came out? Would you go out and just buy aspirin?" They said, "No, I would always go to my GP." And the GP was seen as someone who would be able to take a sort of a general suggestion about taking aspirin and make it relevant to that person, so they would know, is it right for me to take aspirin? And that was almost universal across the people we spoke to. So the GP being a really critical person who they can really trust to give good advice to them. So we then spoke to various GPs about it. It was a very small sample, just to get a real sense of what the issues would be. GPs were not that familiar with aspirin as a cancer reduction medicine. And the things that in order for them to be confident to recommend this to their patients, the thing that they really wanted was authoritative evidence, and they cited two people or two bodies. They cited NICE and they cited the CMO as people or bodies that they would want to come out to give them guidance on this. But with that guidance, I think they would then feel much more confident about offering aspirin. So, you know, hopefully that just gives a bit of a sense of, if it gets to the point where we decide with the consensus that aspirin is important, is a really strong reduction strategy for cancer, gives some ideas of the kind of things that as a community we'll need to be addressing in terms of how we implement this and communicate this. Well, I think the crucial thing with cancer is it feels as if the evidence is becoming stronger about the preventative effect on cancer. I think the evidence that we still need to be really confident about is how does that balance against the harms that taking aspirin causes in terms of the GI bleeds, and therefore that need to balance up that benefit with that harm.